All right. Hello, everybody. I'm here with Chad Beckman. Chad is a PRT, a strength coach, personal trainer. I don't even really know what you do.
Kind of both.
Yeah, all the above. And he is kind of I don't know. I call you an expert at integrating PRI in the fitness world, which is kind of what we've been talking about this month. So I just want to have a time to sit down and just chat with Chad a little bit and give you guys some insight as to what Chad does and how he uses PRI, which is the same kind of philosophy we use in the clinic in the training world, and how we kind of integrate and work back and forth. So, Chad, why don't you just give us a little background about your training background, when you got started in training, how you kind of got introduced into PRI and how you ended up kind of where you were at.
Sure. Yeah, I worked as an intern strength coach at the University of Nebraska from 2002 to 2008. And, in 2002, we were using PRI exercises as part of our warm up to help, keep people out of all these back problems or groin problems we were having at the time. And
I know before you even really knew what PRI was.
Right. Yeah. We go, we're doing left side lying, knee to knees, hemi bridges, really, didn't know, so then, we'd go and do them on each side. Did not know enough about it yet of how to test, just seeing this, other strength coaches use it. The main guy I learned from was Brian Bailey because he had taken all the courses.
Yep. And he was underneath some of the other guys. So early in the PRI kind of world, the university was utilizing a lot of PRI concepts.
Yeah, because Ron would actually come in and we'd have little talks with Mike at the end of our day, and he'd talk about, we'd go over stuff.
And Mike Arth was his head strength coach.
Yeah, at the time. He was really Boyd's right-hand man running the program. And so then from there, I was pretty lucky. I had 4 different head strength coaches in 6 years. So it was interesting to see everybody's program on, what problems you would have. And
right.
I would work individually with kids to, do PRI stuff to help their problem.
Right.
So fast forward after that, when I was done in 2008, I got into some landscaping and actually hopped off just a 4-foot retaining wall and blew out my right knee. I'd ran a 10K the day before, so I'm sure that had a lot to do with it.
Blow
out my right knee, and then I get 7-8 months into that rehab plan, and I still got some pretty bad knee pain. So I started coming here to see Dave, and it was almost immediately. We do a couple little breathing exercises, and I could immediately. I couldn't jog without knee pain. I couldn't get in and out of my car. Couldn't go up and down stairs without knee pain. And I could immediately do all those things after a couple breathing exercises.
They took you back to I remember doing that with those kids years ago, not really knowing what you were doing, why you were doing it.
So then I just looked online. I'm like, well, I have my CSS. So I started taking the courses. So I think it really helped me be able to teach it now because I went through it as a patient at the same time I got my PRT.
Right. And so then you took all the courses that were available for strength coaches, personal trainers, got certified through PRI in we couldn't remember, 2013, 2014.
Yeah.
One of the first 2 or 3 classes.
Yeah. So then I started using, as soon as I started taking those courses, I started using the exercises to do my fit assessments for clients at the gym I was working at.
So at that point, you're not at the university anymore. You're now in kind of a
I was working at a commercial gym here, just about 6 blocks up the street from here, and I was eradicating pain very quickly. Yeah. So then I started applying those body positions and principles to every exercise, and came up with a set of exercises to get somebody strong enough to. What strength level do you need to be at so your problem doesn't come back with whatever your activity is? Do you sit all day at your job, stand all day at your job? Are you a runner? Basically broke it down into those 3 phases and established a strength level so somebody knew where they needed to be to not have their problem come back or bother them.
So you were seeing that you were having less injuries in the people you were training, improving their ability to not feel bad, because they didn't come into you necessarily for injuries. They came to get stronger.
Right.
But at the same time, were you seeing improvements in your ability to get them actually stronger?
Yeah, because you come in for your, you sign up for a gym membership, you do your fit assessment. Well, then if, somebody says, well, this, and this bothers me. Well, my back bothers me, or my neck bothers me, or I have knee pain.
Which is pretty typical when people come to sign up for
sure.
fitness training. A lot of people utilize that instead of physical therapy.
Yeah,
and they say, "Well, I just got to get stronger, so I'm going to go see." Chad.
They don't know because they've probably been most of the time they've been to a PT, but
or we had that.
Yeah, we'll go down that
rabbit
hole. But started showing them the importance of just sensing the right thing on your foot and staying out of your back. And now, can you do that and do a single leg squat, or can you do a one arm press, or an alternating press, or a pull? And created a full body workout based on how many times, or however many times a week they wanted to lift. So they had a set program to do, and then really educate them on the body position they needed to practice being in the rest of the day when they're not lifted.
Right. Which is a key thing always. Not what did you do during a lift, what did you do after?
Right.
And when
so then after, when COVID hit, that gym closed for like 6 weeks. So I just moved everybody, opened a gym in my house, and I just run a private gym out of a gym in the basement of my house. And I do all PRI integrated, strength training.
And you see people in your basement, you see people virtually.
Virtually, yeah.
Were you still going to some other places if people have access to things, or you primarily working?
I primarily just out of my own place now. So,
you stay busy. It's 8:30, 8:45 here this morning. He's already had two clients.
I had a 6 and 7 o'clock this morning.
So he's already two workouts in for the day.
Working.
And I'm on my second cup of coffee. Is all that is. So in general, like I said, if you didn't know what you knew with PRI, what do you think your world would look like?
You would
now, because you see those people too.
Yeah. You take the traditional model of lifting, bench, squat, clean. So like all my high school kids I get, they're being taught how to bench, squat, and clean, but they're just missing a little bit of how to be told correctly how to do it to stay out of your back, or make them aware of what they need to sense on the ground, or how to breathe with it when they do it.
So it's subtle differences, but the impact is.
Yeah, because there's a strength level I'm trying to create on. Well, you don't even have to call it a strength level. It's more an awareness on each side of the body. So when you go do the traditional squat or deadlift or clean, whatever you're doing, you're aware of where your body likes to compensate. Right. So we don't keep driving you further into your mess, because if you keep driving yourself further into your mess, when you get out in the world or on the court or field, you're gonna, why do I keep pulling my hamstring? Or why does my knee still hurt? Why does my back still hurt? And you can see it. I'll show people, I'll take pictures of them and show them where they have overdevelopment in their body because of the pattern, the compensatory pattern they're stuck in and lifted from. Yeah. And so then we just show them, when you get in the right position, take another picture, and it changes immediately. It is. You can see it.
So having that, we can kind of tease in kind of big picture things that we look at, and that asymmetry thought is just, we're not built symmetrically. Why would we train symmetrically? It's just even though it's not really that complicated of a thought, it's so radical compared to what you typically will see out there.
And then each individual is going to be a little different, but if you're going to do a 2-arm bench press, 2-arm bench press, symmetrical exercise, what do you supplement that with? Do you need to do 2 alternating presses or an alternating pull with that? And that just comes down to assessing that person's body of where they like to compensate with what they're doing. But you can do the same thing with a squat. All right. If I'm going to squat, if my main leg exercise is going to be a squat that day, what am I going to supplement it with to?
Which of course people want to squat, right? They want when they come to trainer, they want to bench,
they want to squat the right way.
They want to lift heavy.
Like if you're going to squat, it's not a back exercise. You shouldn't feel your back when you squat. You shouldn't feel your calf when you squat. If the main thing you feel is your calf, your lateral quad, your hip flexor, or your back when you squat, well, that's not going to help that person get faster or jump higher.
So you think you're training the right muscles, but you're really training the wrong muscles.
We make you sense the right thing. So like if you feel glutes and your hamstrings and your abs. When you squat, you're on a pretty good path.
You're in a better position to
sure.
Do it. So you've got you're just managing, the neurological inputs as well as as being mindful of any potential asymmetries. You have some baseline things you would want people to do before you put them on a squat rack.
Sure. Yeah, I'd like
consistent?
to see them be neutral on the table from a PRI standpoint.
You have a table in your basement. You can test people out.
Yeah,
you can show them where they're out.
But then we're trying to develop a strength level on each leg, each side of the body. Again, a strength level, we'll say awareness also. So then when they go to do a 2-legged squat, they have more balance on each side without like wanting to twist
without visibly seeing that asymmetry or sensing a difference.
You see it, like I see it in my, my daughter's going to start 3rd grade. She's 9. She knows my whole program.
Yeah.
So now we've transitioned into start doing some heavier 2-legged exercises. So I have her doing safety bar squat. Yeah. She weighs 78 pounds, but she can safety bar squat and stay out of her back, and I just go by where she feels it when she does it. But she safety bar squatted 105 pounds for 3 the other day. Yeah. But she knows what she needs to find and feel because I created a single leg strength level on each side of her body. So before you started teaching her how to
she's
squat.
Not demanding you squat, so it's a little bit easier.
Again, you pick fun exercises for her to do in the weight room.
Yeah,
jump, land, and create that shock to the system. So she knows.
It's kind of off topic, but just because you brought it up, I know that when I was younger, or even when I was a kid too, they said, well, don't strength train until your growth plates are fully formed, right? So that's old school.
Yeah, because you'll get people who
but that came out of a thing of we don't want to hurt people,
right?
Because you're saying is
you'll have people that are in college or graduate high school and their growth plates are still open.
Yeah.
So start teaching her body how to react to space with her exercises. That comes down to having a warm-up that is putting the body in a good position to make you aware of all 3 planes of movement.
There's 2 of the things we talked about, and you just said it 1 sentence.
There you go. So, but then, create a program that the body can learn to do it subconsciously without cueing it. That's really where it comes down to with your exercise selection. And that could be your warm-up activity, whether it's your dynamic warm-up activity. So like a warm-up you have to lift in the weight room, my warm-up, that's going to be a little different than someone's dynamic warm-up that they have to do like
go for
running or practice.
Right.
And so, but still, those activities should be designed to facilitate or inhibit the compensatory pattern I see in their body.
Right.
And you just build off of that.
Right.
Because if they're doing it, but yet they're still coming back, oh, well, this is tight or that's tight. Well, there's one little thing they're missing on their own when they're doing it, when they don't have somebody watching them so they can correct it.
And we see the same thing when we see people for rehab, right? They're coming in, they're here because they hurt. Like, so we see people more, they're here because they hurt. They see you because they want to get stronger and they hurt, right? But it's the same thing. They're not feeling sensing the right muscles. They're in a compensatory pattern. We're trying to get, inhibit those patterns, get them in a position where they can sense and feel the right muscles in the right way and move forward till we get to a certain level. And then they're no longer PT patients.
Right.
So we then refer to Chad when we get that patient. Says we know that they're in a good position. They have access to certain muscles, but they want to build capacity. They want to lift more, run more, do more activity.
Right.
And we say, well, you're no longer a PT patient, but I got a guy.
Right. Like I had the gym I used to work at, my manager, he was coming here for his back pain. And so I'd see him he'd go do his PRI exercises, his PT exercises I don't think he realized the position he was putting his body into, because then he'd go do his lifting and then he's just undoing everything he just did with his. So I walked up to him and I go, doesn't that still hurt your back? Yeah, it's not really getting better. Well, so I go, come back over and show me your PRI exercises you're doing. And then I'm going to tell you
how to use that when you
need to find and feel and use this muscle, but look at the body position you're putting yourself into when you do it, and now start applying that body position with every exercise you do. And it was like a light went on in his head.
Yeah.
And then his, he didn't have to keep coming to PT after that, because he actually, it clicked in his head.
Because now he could now integrate it into that world that he's trying to get into. So I say, when I have patients and they want to go lift when they're done, we do our best to educate them about those sorts of things. But then they go work with a trainer that maybe doesn't know what you know. And, I still worry as a PT. Well, let me know what they're doing. Call me if you're having problems. But if I send them to you, I don't really worry about that.
These high school kids I get, they're so patterned, you'll just see it, you'll see a left erector that is just huge compared to the right. Yeah. And, wonder why his left hamstring bothers him all the time. Or,
but some people might.
Yeah. Or they're not even looking for it. They're just they're watching the technique. Oh, is your back straight? Well, it looks fine. Well, if you're going to do an RDL, you better not feel your back. Yeah. You can't just feel your hamstring pulling apart to bend over on an RDL. You better use your hamstring to pull your seat bone back underneath you to stand up. And then,
so that takes us back to that. Well, if those kids that don't have formed growth plates are doing that bad technique, that's when I think we see injuries in that population.
Sure.
Whereas if you have the right muscle activity in the right position, I think those lifting activities are pretty safe for those kids.
Yeah.
So just from an injury prevention perspective, lifting is good to get stronger, but we want to make sure we're doing it in a way. So that's what we want.
So once you get a base strength level, then you just keep progressing. Start implementing. When you fatigue the system with a lot of weight, and then can you do it explosively? Right. And then can you accelerate and stay in the right position? And then can you stop and change direction and still be in the right position? Right. But it's
in the training world, that's what everybody's trying to accomplish.
Yeah, you have to be able to look at the body and assess what it needs. And I just use the PRI model to do that.
Yeah, just gives you a framework really to look at.
100%.
So we get our patients to a certain level, and we say, you need to get stronger. I know a guy I'm calling Chad up or texting you. You see, which is an easy conversation because we speak the same language, right?
Sure.
You have somebody that, they're just not getting better. They're still having injuries. We're not going somewhere. Maybe there's something else going on. Maybe it's a vision issue. Maybe it's just something that you need a deeper look at. When do you tend to refer back down and want us to help you with your patients?
Yeah,
your clients.
Yeah, usually after the second or third session, or somebody will have something that's bothering them that they haven't told me about, and they probably should have come up.
Well, a lot of times people they don't want you to think that they're hurt. So
sure. But I can identify it, show it to them, but I'll send them here. It's usually because the PT exercises they have been doing are not making them aware how to inhibit their compensatory pattern. So then they understand after they come and do PT here, then they understand why the position I want them to do their strength exercises in are so important.
And then you go back and say, well, that's why that exercise you were doing that was supposed to be good for your back really wasn't so good for your back. Right.
So then that'll click. Yeah.
So it's the same thing. You don't want to send any PT that says, well, go do a bunch of more Supermans and bird dogs and then come back and see.
Why can't I lay on my back and do these leg raises for my abs? Well, way too much hip flexor.
Yeah.
We'll show you how to use your hip flexor and not a compromised
So this is kind of an interesting question. I just thought of this because we just put out something this week and said, well, here's three things that we usually see in the gym when people are doing gym work. It's like, oh man, I go work in the gym. I was like, oh, that guy, I should just give him my card because I know he's doing something wrong, or you can see their squat and they're unbalanced, or you see rib flares or all these things, and we know that. You could look at it from a training perspective. And what do you see when people come and show you their physical therapy exercise that makes you want to go, oh, you should be doing that? Because it's the same thing. Because these people aren't necessarily taught wrong.
It's usually the same bad posture that you're seeing on the bench, squat, and deadlift. Yeah. And so it's actually I have a video that I'll show them because when I used to work at the gym, there's the leg press machine where the foot plate is stable and the seat slides. Well, if you look at that seat, it has two posts that slides on. So if I push the seat all the way up, you can see how it's just worn and almost worn out on the right side. But then I'll also use that same machine to get them, like if I retract my ribs and inhale and tuck my pelvis, when I'm up in the air, you'll see the weight stack go up.
Just from putting your body in a good position.
Sure. So when they see that tells them immediately they created some length somewhere in their body, which is going to be their spine.
Yeah.
Because we're not locking out our knee to do that. But then if they do their sit up straight, you see that weight stack immediately compress.
Which is compression of the pressure came in your back.
Yeah, and that's not where we want to live or lift from.
Right.
That's there's no way that's neutral.
Yeah.
So if you're going to move from that position, you're going to create compensatory patterns, and not just that, you're going to create growth and muscles that won't let you get out of it.
Right.
And that's what I'm trying to inhibit and teach people's body how to delay their compensatory patterns. So when they can go out on the field and run and be fast and do all these things, and you can be the most talented guy on the field, but if you're hurt on the sideline,
you're not getting paid.
You got a problem.
Yeah. So again, same thing. We want to send people to you to lift the right way. You want to send people to us to get PT done the right way.
Yeah.
And again, it's a real easy communication. The bridge there is real nice. So we feel blessed because we don't have to really work that hard at it.
Yeah.
I know people out there that don't have that necessarily, but finding somebody they can do that with is great. Chad mentioned he does training virtually. So if somebody really wants, hey, how do we do it? It's not.
It's like some people would say, especially when I'm training virtually, man, I just wish you were here to show me this. Well, even if I was standing there, I'm not going to tell you anything different. Like I don't have to touch your body to get you in the right position to push and find and feel something. Yeah. Like it's kind of like all the manual work you can do from the respiration course. I can put you in a position on a machine or a cable machine and get pretty close to air to expand where I want it to and accomplish the same goal. Right. So even if it's virtually, we can still get a long way. It's just as if I was seeing you in person.
I found actually doing virtual clients has helped my skills as a clinician, because you have to learn how to communicate and get people to sense and feel things with their own body rather than putting your hands on them. So I think it's helped, with local patients, but also with people online to be able to actually talk through it and get them to do it themselves.
And I'll have some of because when I go on vacation, I'll usually still train a couple people in the morning. And so my clients that I see in person all the time, when I'm training virtually, they say I talk a lot more virtually because I want to make sure they sense and feel it as they doing it, but they're picking it up from me saying the words, not just them thinking I'm there standing watching it. Yeah. So it's actually, some of them will say, well, that's a better workout that way.
Some people like the hands-on. I mean, it just depends.
Depends on the person.
But it's definitely something that can be done virtually as long as they have access to the equipment that they need, which doesn't need to be a lot of equipment.
No, because
so I know you've got a nice cable column set up in your gym downstairs, but there's a lot of things you can do with. What do you want people to have if you're going to work them out virtually? What kind of equipment do you need to get a good workout?
If they have a board to stand on, a little block, your block. But a lot of time, the floor is great. A wall. We'll use a ball once in a while. Yeah. We use the big resistance bands work great.
Because you like the really big loops.
Yeah, the really big ones. So like
long loops, and you get them.
You can just, I go to Amazon. I just send people an Amazon link because you can get a super cheap set, but because that's what I'll travel with to use as my resistance when I'm doing my exercise. Because I can do every exercise. I can do it with a free weight or cable. I can do it with a band. Right. And then the band works great because it's usually gives your body something to push into. Or the band.
That's why I like bands. It gives you that. It's something you have to feel while you do an activity.
It pulls. You stand on it. And
so you get a set of bands, you get a couple weights and gravity.
Yep.
And you can get a pretty damn good workout. And so it doesn't mean you have to have a lot of equipment, but you can do it.
Like the other day I had a kid, he came in and he said, my back has just been bothering me. It's bothering me. So he happened to be there on one of his explosive days and we were doing clean pulls and hang clean. So I just put a balloon in his mouth.
He said, no, I take that.
To do the clean pull. And he was just like, his timing was just off a little bit, but like he likes to brace when he runs and jumps because he's a long jumper. And so we just, he needed to figure out when his body likes to hold its breath and the timing of when he jumps. And boy, it just, man, made his system unlock just like that.
Kind of cool.
Yeah.
So, what would you say are kind of maybe your top 3? I just hit 3 out there, like cues that you're using all the time when you train people. Like, what are you really focusing on? If you had like just like big picture.
Yeah, I'd say a low back stretch because you're retracting your ribs, which should also tuck your pelvis. And
so you're saying people should feel a low back stretch when they do activity, which is a little bit different than just about everybody else.
Yeah, we're not. I don't want this sternum pushed forward. We're going to create a low back stretch. Now,
you're not saying round out your back.
No, because like people, so like I'll say that and then they immediately do like that. No, that is not what we're doing.
Yeah.
So, but
that's a great cue to be able to say, do you feel that?
Yeah. So
stretch?
Because when I tell them to round out their low back, we'll say like bra strap to waistline, or for a male, mid back to waistline.
Yeah.
But you can see when they go to do it, like most people all do this. Am I doing it? No, you just flexed your neck. But that's another thing they don't know, or they don't realize how much they're using their neck to do it.
Right.
But yeah, just a sternum back, low back stretch, and then just a chin up. So I feel my abs. And when I do that right now, boom, immediately puts me on my seat bones.
Yeah. So that's just a really cool cue that says it's a different kind of thought, but can you maintain that stretch, that sense in your back that your ribs are back?
Yep. So then on there,
rounded, but back.
Right. Back. Like we're taking your center of gravity and moving it back. Yeah. So then can they maintain that and then stay on a heel with their foot flat, midfoot to heel?
So feet sense is huge for
huge you. With a knee unlocked.
Yeah.
So and then have them just, if I'm going to show them a single leg RDL, can they maintain that as they bend over and stand up? Because, I'll tell someone to be on their heel, and if they're that neck person, which is a lot of them, they're trying to pull their toes up to be on their heel. Well, that's going to pull your center mass forward.
Yeah.
And now we got, definitely do things supported to make them sense. I know in the strength training world, we want to do all these things unsupported because we're creating proprioception.
Right.
Well, yes
good
and no.
Or bad?
Good. Can I, if I'm creating proprioception to feed me into my compensatory pattern, well, I don't want that. I'm just going to compensate more in the place I'm already compensating.
You're going to feed the beast a little bit. Yeah.
It's like even when I worked at the gym, I'd use the machines a lot because it gives me a thing to push back into. And then the client didn't have to worry about the guided path of the movement. But it really comes down to them sensing how to turn and reach without cueing it. And I can get that done by getting their center mass back, and then they'll start feeling it. They'll feel their center mass change size.
Where they're going through their feet as long as they maintain that stretch in their back. So, those are two really easy things. I know sometimes we get through PT and we're like, well, everybody's so like dialed into having to do everything just the perfect way. So sometimes they become a little over. We see this. People have been overtrained how to I always have to make sure I'm on my left heel all the time. I always have my left adductor engaged. Those are good muscles, but it's not like you're saying stay on your left heel the whole time when you do those activities.
No, so especially as I started incorporating this into my exercises after I started taking the courses, I'm just thinking, oh, well, someone's going to leave this session and have to use both legs. So then we just started teaching them how to be on their right leg, and the cues on their right leg were to teach them how to shift their center of mass left.
Or I just tell people, I just don't want you to fall to the right. So when you're to the right, just don't fall to the right.
They're like, well, how will I know if I'm doing it right? Well, because you'll feel the muscles holding you up on the right instead of gravity pulling you over there.
Yeah.
So if you're pushing on this bursa sac all the time on your right side, or you're in this hip flexor over here on the right side, that's usually what I'm going to see.
Or SI joint or
whatever it is. Yeah. That's usually what I'm going to see.
Yeah.
And so teach them how to shift their midline left to do your right leg exercises. And then on the left leg, teach you how to stay over here longer. Because as soon as we ramp up fatigue or put a load in your hand and that center mass is flying back to the right too soon, and then you're extending or hyperextending your back too soon to do it, that's the whole.
And they'll either they'll lose their stretch in their back, or they'll change what they're sensing with their feet.
Yep.
So again, those two cues I know are awesome. How much do you cue breathing initially in your training, and then over time does that become less of an issue, more of an issue?
When they first start, well, if by getting their ribs retracted, sensing their heel with their knee unlocked, if they still don't quite feel it where they should, then I'll specifically link breathing with it.
To use that as a tool to help them get what you want.
Yes. But then, they should become aware pretty quick, so it happens without linking the breathing with it.
So it's a tool you use, but it's not everybody has to get in a position, do
Right.
their deep breath, do their PRI breath or whatever, unless they can't get into a position.
Yeah. Most people that are still compensating as they keep coming back to work out, it's we got to inhibit the stress in their life to help them get out of their compensatory patterns they like to move,
And that's when you ask the other question. Well, what else is going on? What are you doing at your work? What's your visual system? What are your glasses doing?
Yeah. How are you?
Are you sleeping at night?
Exactly?
What's your diet? I mean, all those things.
That's a big part of it.
And you'll see it in the clinic. We see it with people that don't get better with PT, right? You should be getting better. Why aren't you getting better? Why
what
aren't they
is it?
progress?
Yeah.
So then you can ask those questions and dig a little bit deeper. So that's a.
But yeah, every exercise has there's a like if I was going to do 3 or 4 sets of something, actually probably the best question someone asked me someday is, why do we do 3 or 4 sets of everything? Well, the first set,
that's a great question.
We're just trying to get you to sense what I just demonstrated.
Yeah.
And then the second set, you're probably becoming, a little more neurologically aware of it, the timing of the movement, the breathing of it. And then the third or fourth set, we're really actually building the muscle while you're doing it.
Right.
That is a big component of it, but you can use as you ramp up fatigue, then maybe I'll link I can link the breathing with it in any set, no matter how tired you get, to get the result I want out of the exercise.
But you're doing that as a tool when you need it, not necessarily as the driving.
Right. That's more comes down to assessing their body as they do it. That's
I know
that's hard to teach. That's hard to pick up and see.
Yeah, some people that have been really, really, as a patient or client, PRI-trained, they get so sometimes almost over caught up into staying in a left AIC, staying in their left hip, staying on their left side, keeping their left rib down and their, which are all things that we want. But sometimes we start restricting the ability to move when we get so caught up. So once they get to a training perspective, I think it becomes a little less
a lot of them,
rigid in the never do this, don't do that.
Right. I don't have any mirrors in my gym because I need them to sense the position without look. Because that mirror that's not a true replication. If you want to see a true replication of yourself doing it, you should video yourself doing it and then watch it. But don't video it by flipping your camera, because it's going to show up opposite on the video.
Might as well look at a mirror. Yep.
Yeah. So it's a
kind of a cool.
Because I'll have people. I'll have people. Well, it just doesn't feel right when you're not there. Well, take video of yourself doing it and send it to me, and I'll watch it.
Yeah.
But that's a lot of it. When they're there, I'll take video of while they're doing it, I'll have them watch the video so they can see themselves
without looking in a mirror. Because we do this with patients too. If you look at a mirror, the person standing in the mirror, if you were to flex your right bicep,
that's
the dude in the mirror is left bicep.
Yeah, I'll take them to the mirror and show them that.
Yeah, and then, that's right. So if you think what you think is your right side is really when you're watching in the mirror, your opposite side. So it really can help you kind of feed your pattern if you think you're doing it right, but you're actually just feeding asymmetry. Now, for some people, that's a good confusion to try to figure out how to make mentally that connection between. I have to figure out how to make that mirror image do what I think I'm supposed to be doing on my opposite side. It can be really challenging, kind of cool exercise. So we have some mirror exercises that we'll do, which I find really effective. People who have had concussions or where they've been a little bit scrambled, they don't really get right left.
Find them
very, very well.
Right.
That the mirror at that point is healthy, but a lot of times it'll mess people up just to look in a mirror. They can't figure that out for nothing. Yeah. That's a really cool thing.
But also linking that breathing with it too. The timing of inhale or when to inhale, you can use the breath to get, to inhibit your compensatory pattern as you're doing the movement, or I can facilitate.
Yeah. So is it always inhalation on the way down, on the way up?
Like sometimes when I'm first teaching somebody the warm-up exercises, if I was going to link breathing with it, maybe we would inhale and really help them get their center of mass back.
Yep.
And then exhale for, how many reps can you do like this? I do this standing hip shift a lot. Can you exhale for 3 hip shifts? Can you exhale for 5? And then, we're going to repeat that process till we get to 20 or 25 reps. Or like on a single leg RDL, I'm going to inhale and find everything I need to feel, which is usually a heel, an unlocked knee, a low back stretch, and then I can have them blow out to go down and up. Or, if they can find and feel everything without losing it, then we just inhale down, exhale up.
So it depends on the patient and where they're at, whether it's because everybody says, isn't it always inhale?
I can use the breath or just watch their body or where they're
so it's
cheating.
Again, it's a tool, but if you're not even aware of breathing to begin with, it's one tool you have in your pocket. It's really powerful tool, which we know from PRI that really helps us out. So we talked asymmetry, which is a kind of an inherent thing. So you train a lot of alternating, a lot of single leg activity. I mean, percentage wise, what would you say you do, bilateral versus unilateral?
Unilateral and alternating, I'd say, is probably 90% of your exercises.
Compared to a traditional gym where
like if you were going to
95% is probably bilateral.
Like if you're just going to go, okay, I'm going to squat this day and I'm going to do RDL or I'm going to bench. But if it's a leg day, gosh, if I'm going to do a 2-legged leg exercises, my next 2 leg exercises would be a single leg movement or some kind of a.
And that's your bias. And that would be a bias that really is PRI informed that says we're not symmetrical. We shouldn't train that way.
Right. But you can build a lot of mass and bone density by doing, a 2-legged exercise at one time,
which is the value of it.
Right. Because you're going to ramp up that sympathetic tone in the body, which is what you need to be good at sports.
So sympathetic tone's not bad.
But you also got to know how to shut it off.
Right. That's the key. That's where we're headed.
If you can't shut it off when you're done,
which is where you would use your breathing activities potentially. And then you talked about having a nice warm up. I know you have to warm up. Everybody does a nice good PRI informed warm up before they work out. Do you have a cool down kind of routine that people do too? Or
the quickest thing to cool down, like for my client this morning, she was just really in her neck today. So to shut her down, because it didn't matter what we did, she starts getting tired, she started to feel her neck at the end. So to shut her down, we went and got on my treadmill, put it at a 15-degree incline, started walking backwards. Mm-hmm. And it's, she said, well, I feel that right here. I go, well, is it here or here? So it was her hip flexor. So especially on her right side, her hip flexor was starting to lengthen. She goes, well, now I feel it over here. Well, now that TFL on the left starting to lengthen. And we just kept going until she felt
hamstrings, heels. She's going backwards. So the ribs have to go back.
Yep. She is stepping back and that hamstring is glued is short. So how many steps does she have to take? And I didn't link. I could have just as easy linked the breathing with it as she stepped.
But she wasn't holding breath.
No. But
she's talking to you.
3-5 minutes, she felt both glutes. Boom. Done.
She's done. But having something intentionally you would do after your workout.
Yeah.
So something intentional before. Like I said, if you're going to program a bilateral lift which is good for mass, for power, for explosion. I mean, that's the reason that they're gold standard activities.
Right. It's
what are you doing around it that helps maximize its efficiency with minimal risk to that system. Right.
Yeah. Say like an explosive day. So we're going to do hang cleans or like even we do a lot of dumbbell snatch. I'll even put them back on a table and test them to see if it did anything.
Yeah. Before, after, which we do all the time in PT. Yeah. Was this exercise beneficial or was it not beneficial?
Yeah.
And you can tell right away whether it's not.
Anything at the end that's going to get their system. I'll just put them in the fetal position.
Yeah, flex
their spine. Or a great one is I'll have them just go sit on a stair and put one of those big resistance bands around their low back. Try to like right below the SI, and I'll just hook it right on their patellas and have them just sit there and breathe. Like, oh, that feels really good. Because even if you do sit there and let your knees flare out, it's still pulling the femurs into the sockets, which is pulling your hip underneath you, and just breathe.
Yeah.
It don't take long, a minute or two.
Yeah.
Or you can do the dowel in the doorway, squat hold. That's a great inhibit. I mean, we'll do that.
But you're doing something, right?
Yeah.
At the end, you've done a bilateral lift or a sympathetic tone lift, which sympathetic system is a great system. It's a very valuable system. It just needs to be managed.
Because I'll get, if my high school kids, I'll make them get pretty close, 1.5, 2 minutes on that hold, that squat hold, and staying on their heels, and actually being able to push down hard enough and feel their glutes just as much as they feel the top of this thigh doing it before on the squat with a barbell on their back.
And the shake like crazy without having to do it, even have to put them under load.
But I'll have them doing trap bar deadlifts or squats also to help teach them how to, when they're hanging on to a trap bar, don't pull the trap bar up, pull the floor up so you can sense your body going down. Then that helps them keep their center of mass back.
And it's just cues. Last thing that probably is a kind of a big picture thing is most traditional lifts are that sagittal plane, front to back, squat, deadlift, hang clean activity. But we like to incorporate multiple planes of movement, side to side, rotational activity. How does that kind of inform what you do in terms of I know you're constantly looking at rotation and frontal plane activity.
It really comes down to each person on when their problem arises. So let's take a runner. I can make it this many miles before it happens. So then it comes down to having the strength level to get further than you want. So I have 3 main leg exercises I'm using for that. A single leg squat. I have a knee on bench RDL that I do, and then like a loaded step down.
Mm-hmm. And each one, because it's single leg, there's automatically a frontal plane control issue because they have to manage their center of gravity over one leg more than the other. And you're incorporating rotational.
That's why I like the single leg movements, because you're getting rotation in the single leg movement. Right.
So you don't even have to think about adding rotation; it's there.
So I'm not gonna drive you into more hyperextension in your back. I'm gonna drive you into your glute or your hamstring or your abs more by doing it, no matter how tired you get.
Right.
So I try to use the position and the technique of the exercise, no matter how tired you get or how much weight you hold in your hand, to do that activity.
But that automatically integrates those 3 planes of movement. So anytime you go to a bilateral lift, you're really limiting frontal and transverse activity just based on the position alone.
Yeah, and I don't have everybody's got about 2 warm-ups we'll do in a typical session, and then I only have about 2 or 3 people where we'll actually do an alternating push first, and then an alternating pull, or an alternating pull, or a one-arm pull, and then an alternating push, and then go do the leg exercise. But most people, we do the leg exercise first, leg push pull, because I need that system ready to go
where it's at.
But
it's the same thing. Just by doing a single arm push or a pull, you've already incorporated a transverse plane, either stability component or actual movement component.
And a lot of times with that rotation, I'll just watch people, especially the women, they think they're reaching, but they're really shrugging to do it.
Upper traps.
Yeah. But then if that happens,
and awareness and showing
if that happens, that person's center mass went forward, and their back would have had to have extended
and they lost their sense of where they're at on the ground.
Yep.
So neck problems started with the feet. So that's what I mean. Just hits those kind of big things: asymmetries, triplanar activity, breathing, warm up, cool down.
It's like everybody has this idea, like especially these high school kids that they see the weight that all these kids are lifting to get their D1 offers. Well, all right, you can lift that much weight. Does that mean that's what makes you run your 40 that fast? Or you could do 220, 25 bench that many. Okay. But what if a kid can stay in a better position and do lighter weight, and that makes him faster?
But they've got faster 40 timer, faster side to side cone drill, or they're the functional training, the functional performance aspect is not just how many reps of the bench can you push out.
Yeah, it's just what are your battery of tests you're going to use to see if their performance is going to improve.
And that's the tough because they're going to be judged on 225 bench. How many reps you got? as well
Yeah.
as, you know, a 40 time
Sure.
or a lateral cone drill time. So it just gives you an ability to kind of work on both those things.
Yeah, everybody has, you know, a good battery of tests to see if, I mean, well, you should be, how are you made? You have to find a way to measure your performance. And if you're not doing that, so like I came up with a strength formula on all your single leg movements that you should be at before or to complement your two-legged exercises. But that comes up, that could be a whole nother talk. You're talking about now periodization and structure of a program based on your sport activity and year round of what to do.
And when you want to peak and when you don't want to peak.
That'd be a whole
yeah.
another talk.
Yeah. And you know all that, and I don't have to know it because I just send them to see.
Yeah, right.
That's all I got to do. Well, Chad, this is awesome. Any way people can get in touch with you? Like, what's the best way for people to find you? Obviously, get in touch with us. Like, if you want, I can.
Yeah, my email works good. movementrepattern@gmail.com.
I'll link all this kind of in the video too.
Even my phone number. I have no problem giving out my number because I train people. Some people use Zoom, but a lot of people, especially internationally, we just use the WhatsApp app a lot, or even like if someone's a Facebook person, let's call them Facebook Messenger.
Yeah,
because it's not like you don't need the recording of the video. Like the exercises we go over, we'll send you a video of all the exercises to do, and then when you start doing them, you're going to take video of them doing them, send them back to me.
Yeah,
and
so there's this communication which works pretty well. So
works real good.
So Chad's available. He's willing to help out. I know you also like helping, you know, other trainers if they have questions. Do you mind?
Yeah, I'll have people like people.
Hey, I'm just getting into this PRI business.
There's a ton of trainers or people that come into town for courses, and they'll look me up and they'll stay an extra day or after
We've
their
had
course.
patients that've been here
They'll come. We'll come and go over stuff.
So I know Chad's very generous with this time in terms of helping people out if they've got questions. But
you know, most people that work all day during the day, it's good. I have no problem seeing people on the weekends.
That's why you've already done two this morning. Like he's off in the middle of the day out.
Right.
The kids in the backyard doing.
Yeah, I mean, just to set this up, I think it was about a month ago. I started opening my schedule to.
Any advice you'd have for people who maybe are strength trainers, you know, and they're just kind of dabbling into this PRI thing, and what would kind of the next step would be? What would you say would be the biggest way to help them kind of take that next step and integrate?
I'd come to a course.
Yeah.
You know, a Myokin's a good course. I know I started with Myokin, and then I did Postural Restoration, and then I had INI. But that pelvis course was probably what really put it together for me, and
which is really everybody thinks it's a pelvic floor course. It's not for pelvic floor.
No.
It's about pelvic floor, but it's really pressure management. So anything if you're loading somebody up, being able to manage pressure,
right?
That's the game. The name of the game, and the pelvis course is one of the best courses that really integrates and talks about that. So even though people say, "Well, I don't do pelvis,"
so then that's.
If you got pelvis, you're training the pelvis.
Yeah. You can't just stay in if you're going to be a personal trainer or a strength coach, you can't just stay in your basic certifications. You can get like your CSCS, your ACSM, or your NASM. You know, it's not going to.
That opens the door so you can start to figure out what you really do.
You can start learning, exercises and periodization, but to specifically help people and keep them from re-hurting themselves or keep having their same problem.
To be the best trainer
you're gonna have to figure out why this is happening.
Yeah.
Like I would want to know.
It was the same thing for me as a PT. I got done with PT school and I realized pretty damn quick I didn't know what the hell I was doing.
Yeah.
I knew what I was doing, but I didn't know why I was doing any of it. And so that just having that like I said, that framework that says, well, I found something that helps me inform my decisions about why I'm doing what I'm doing. And it just happens to also be very effective and very valuable. So
so I'm starting to create a course where we're going to start teaching that. So
keep the eye out. Mini teaser.
Mini teaser.
Yeah, but he's available if you have questions and you want to or just want to train with Chad at school. All right, Chad, that's all I got. Unless you have anything else that you really.
No, we touched base on a lot.
Yeah, I said, we could talk for probably an hour just on how to get people out of their back.
Most people are going to have questions on why I picked this exercise or what strength level you want someone to be at. or how to start, how to start programming.
When do I
It's
do it?
gonna
How
be-
do I, and that's
yeah.
all. I think it's all individualized based on who's in front of
Yep.
you and what your goals are and what you want to do. So
Yeah.
that'd be a question that's hard to answer on this kind of a format. It'd be,
Correct.
hey, let's chat. Let's
Be-
figure out
yep.
what's good for you. So, all right.
It's great.
Appreciate it.
Yeah,
for
thanks,
coming.
Torin.
Yep. Have a good one. Thanks, guys. We'll talk to you soon. Bye.